welcome to this seminar on healthcare technologies industry, needs and unmet needs. So I'm going to be talking about the point of care testing, where it fills the gap between the test and treat. So if you look at India, it's a dichotomy. 70% of India's population lives in the rural areas, but 75% of the medical infrastructure is in the urban areas. Nearly 86% of all medical visits in India are made in rural areas, with majority of people traveling 100 kilometers just to avail a healthcare facility. One gap that we're facing, that India has very low healthcare providers. This is as per WHO study done. So the point of care devices can help fill this gap, because for point of care devices you just need a trained person who doesn't need to be a laboratory technician. All the swabs that were being used in the viral testing medium were being imported from China, and there was a shortage and it was at a high price. And that's when the government stepped in and they contacted Reliance, they contacted J&J, and they got together, and within 10 days India was manufacturing swabs on its own, and this brought the cost down to 1/10. So it helped fill the gap between the high costing and the supply chain. Now coming to POCT devices. So as the biggest gap is between test and treating. Most people think that POC is only about glucometer testing, but that's not true. The POC market is evolving extremely fast, and if you look at all these devices, they can do complex testing even now. Another success story, a simple point of care device, a pulse oximeter. It's not very expensive. It's a solution at your fingertip. And this can again help the hospitals, because the patient can be monitored at home. He can visit the hospital before he becomes seriously ill. So this again can save time, and in critical illness, time is life. And even as per a study done, at intervention at an early stage of detection of oxygen saturation levels could prevent deaths due to COVID-19. Another big challenge that I've seen personally is maintaining a cold chain. We all know that we are facing, there's not a shortage of food in India, but there's a shortage of food because the cold chain is not available and a lot of food rots on its way. Similar thing has been happening in the medical supplies. A lot of vaccines are not maintained in the cold chain, and that's why they lose their potency. And similarly in reagents, which are based on enzymes, they need cold chain from 2 to 8 degrees. And we have seen in the rural areas, there's a severe problem of having electricity. So a lot of times the electricity goes for hours and maybe even a day. And that's when our reagents, our diagnostics can get exposed to temperature and they can lose their efficiency. This is another big challenge. Most of the point of care testing reagents are stored at room temperature. So again, for a country like ours, it's a big boon, because they don't need a cold chain, and the cold chain works out expensive and it's not reliable also. Thank you for your time, and we are very blessed to be in this great industry of healthcare and diagnostics, which plays an important role, and especially in this pandemic, by providing accurate diagnostics to the industry.